Did you know your heart beats about 100,000 times a day? It's the engine of our body, working tirelessly alongside our blood to keep everything running smoothly. But what happens when this vital system faces a challenge? Today, we're going to explore some common, and sometimes serious, conditions that affect our heart and blood, like heart attacks, strokes, and anemia. My goal isn't to scare you, but to empower you with knowledge. Understanding these conditions is the first step toward prevention and living a healthier, longer life. So, let's get started on this important journey together. First up, let's talk about heart attacks, or what doctors call a myocardial infarction. Imagine your heart is a house, and the coronary arteries are the pipes bringing it the oxygen-rich blood it needs to function. A heart attack happens when one of these pipes gets completely blocked, usually by a blood clot that forms on top of a buildup of plaque, a mix of fat, cholesterol, and other substances. When that blood flow is cut off, a part of the heart muscle doesn't get oxygen and starts to be damaged or die. The symptoms can be classic, like chest pain that feels like pressure or squeezing, pain spreading to the arm, neck, or jaw, and shortness of breath. But sometimes, especially in women, the signs can be more subtle, like unusual fatigue, nausea, or back pain. It's a true medical emergency, and every second counts. Calling for help immediately is crucial to restoring blood flow and saving heart muscle. Now, let's move from the heart to the brain and discuss strokes. While a heart attack is a heart crisis, a stroke is a brain crisis. They are surprisingly similar in what causes them. There are two main types. The most common is an ischemic stroke, which happens when a blood vessel supplying the brain gets blocked, much like in a heart attack. This starves brain cells of oxygen, and they begin to die. The other type is a hemorrhagic stroke, which is less common but often more severe. This occurs when a weakened blood vessel in the brain ruptures and bleeds into the surrounding brain tissue. The symptoms of a stroke come on suddenly and can be remembered with the acronym fast face drooping, arm weakness, speech difficulty, time to call for help. A stroke can have life-altering consequences, affecting everything from movement to memory. Just like a heart attack, it's a race against time. So, we've talked about a complete blockage causing a heart attack. But what if the blockage is only partial? That's where angina comes in. Think of it as a warning sign from your heart. Angina is chest pain or discomfort that happens when your heart muscle doesn't get as much blood as it needs. This usually occurs during times of physical exertion or emotional stress, when your heart is working harder. Unlike a heart attack, the pain from stable angina typically lasts for a few minutes and goes away with rest. It's your heart's way of saying, "Hey, I'm struggling here." The pipes are getting narrow. While it's not a heart attack itself, it's a major red flag that you're at a high risk for one. It's essential to see a doctor if you experience this, so you can take steps to manage the underlying coronary artery disease and prevent a more serious event down the line. What's a key player in creating these blockages? We've been talking about. Often, it's high cholesterol. Cholesterol itself isn't a villain. It's a waxy substance your body needs to build healthy cells. The problem arises when you have too much of the bad kind, known as LDL cholesterol. Imagine LDL as little sticky packages of fat traveling through your arteries. Too many of them can start to stick to the artery walls, forming that plaque we mentioned earlier. Over time, this plaque hardens and narrows your arteries, a condition called atherosclerosis. This makes it harder for blood to flow through. The scary part about high cholesterol is that it has no symptoms. You could have it for years and not know it. The only way to find out is through a simple blood test. The good news is that it's often manageable through lifestyle changes, like a healthy diet and exercise, and sometimes with medication. Now, let's shift our focus from the heart and its plumbing to the blood itself. A very common blood disorder is anemia. If your heart is the engine, blood is the fuel delivery system, and red blood cells are the tiny tankers carrying oxygen. Anemia is a condition where you want to have enough healthy red blood cells to carry adequate oxygen to your body's tissue. When you're anemic, you might feel constantly tired, weak, or out of breath. You might look pale or feel dizzy. It's like trying to run your body on a low-octane fuel mix. While often caused by iron deficiency, anemia can also result from a lack of certain vitamins, chronic diseases, or other underlying issues. A doctor can diagnose it with a blood test and recommend the right treatment. which could be as simple as taking iron supplements. Finally, we need to discuss a more serious blood condition, leukemia, which is a type of cancer of the blood-forming tissues, including the bone marrow. Our bone marrow is like a factory that produces our blood cells. In a healthy person, this factory produces the right amount of red cells, white cells, and platelets. In leukemia, this factory goes haywire and starts producing a huge number of abnormal white blood cells that do function properly. These abnormal cells crowd out the healthy, functional blood cells. This can lead to a variety of problems. Frequent infections because the white blood cells and fight germs. Anemia because there aren't enough red blood cells. And easy bleeding or bruising due to a lack of platelets. Leukemia has many different types, some that progress slowly and others that advance very quickly. Symptoms can be vague, like fatigue, fever, and weight loss. It's a complex disease, but thanks to incredible advances in medical research, treatments like chemotherapy, targeted therapy, and stem cell transplants have dramatically improved survival rates and quality of life for many patients. So, we've covered a lot of ground today, from the plumbing of our hearts to the very essence of our blood. Understanding heart attacks, strokes, angina, high cholesterol, anemia, and leukemia helps us appreciate the intricate workings of our bodies. More importantly, it highlights the power of prevention and early detection. Many of these conditions are linked to lifestyle choices, eating a balanced diet, staying physically active, not smoking, and managing stress are not just cliches. They are powerful tools to protect your cardiovascular health. Regular checkups with your doctor are also vital. They allow you to monitor things like cholesterol and blood pressure, catching potential problems before they become emergencies. Remember, knowledge is your best defense. Taking proactive steps for your health is the greatest investment you can ever make in yourself. If you ever experience symptoms like severe chest pain, sudden weakness on one side of your body, or difficulty speaking, please do not wait. Call your local emergency services immediately. For non-emergencies, or if you have concerns about your health, talking to a doctor or a qualified healthcare professional is always the right choice. They can provide guidance and support tailored to your specific needs. Taking care of your mental health is just as important, as stress can significantly impact your physical well-being. If you're feeling overwhelmed, don't hesitate to reach out for help. Thank you so much for joining me today to learn about these important health topics. I hope you found this information valuable and empowering. If you did, please give this video a thumbs up and consider subscribing to the channel for more content that helps you live a healthier, happier life. Don't forget to hit that notification bell so you won't miss our next video. Stay safe, stay healthy, and see you next time.